what Margaret said was that this would suck out young, healthy people from the existing system and then send them to the new plans and destabilize the market. How likely is that?
Well, I have to say, I'm actually a little disappointed. The executive order didn't live up to all the hype. To answer your question, probably unlikely. Both. It's unlikely to be successful, although they didn't define success. But it's also unlikely to suck the young out of the current system because, quite frankly, the young are not in the current system. So I don't think they're going to go anywhere. We've had association health plans in the past. They really haven't worked that well. I don't expect they would now. And the short-term insurance plans generally are the kind of thing that the older and sicker people joined in the first place, which, by the way, is why we had to have Obamacare in the first place. So I think that I think that concerns on both sides are actually overblown, and for me, it's a giant nothing burger.
Well, hang on a second though, Les. Give us evidence for that. If you're an insurer, why wouldn't you be delighted with this idea that maybe you could, negotiate individually with various different groups who have probably got plenty of healthy young people in them, and you won't have to worry about the other portion of society where there might be some sick people?
Right. Well, that's in a perfect world, but what happens is association health plans tend to be freelancers, and they also tend to be older. I wouldn't expect that would happen. If in the best case for insurers, and you can kind of see the insurance industry, the stocks have not done much on this news, is that they would take maybe groups from the individual market and then they'd all join these association health plans and they'd administer those. But realistically, I don't think a lot of young people have insurance at the moment on the individual markets.
When we talk about the stocks, what would this mean for healthcare, managed healthcare stocks, but also for those hospitals, not the big ones, but the rural ones in the outskirts of the country?
Right. Well, the rural ones, and they don't have stocks, but they do have issue bonds. They are in trouble as it is because they just aren't making enough money, and a lot of, especially the rural hospitals, are teetering on the bankruptcy in a lot of places. And to the extent that people go in uninsured, they don't pay their bills, it puts even more pressure on the rural hospitals. And I would expect to see more bankruptcies on the rural hospital side. Again, more of a debt issue than an equity issue, but it is also a healthcare access issue.